Right, I'm getting back up.
Okay.
I got some backup coming.
It's an open position now, so.
Okay.
See it removed from the TV.
No.
So we're testing the audio. Can you guys hear me okay? All right.
Can you speak? Have them speak.
Can someone, Kim, can you talk, unmute yourself and talk and, so we can see if we hear you?
Good morning, Tara. How are you today?
Good morning. Okay. It's only through the
How much time do you
laptop.
have?
We have some time.
But send a CTN account a request to join the meeting.
Okay,
So it's CTN account, one word.
let me log in. 1 minute. We're gonna do another technical fix,
You're the
so
host, right?
I am the host, yeah. And we will start momentarily. 1 second. All right, just testing to see if you guys can hear me.
Yes, we can.
So you can hear it in the room too. Try one more time.
I can hear you, but it's very echoey.
Yeah. What about now? Mm-mm.
You still have.
Yeah, there's still a huge echo.
Can you hear me now? Check 1, 2, 3, 3, 2, 1.
Yeah,
Yes,
it's good
perfect.
now.
How about now? Audio check 1, 2, 3, 3, 2, 1.
Hear you fine.
Really noted.
Everybody's the same way. The button that's right. If there's two of them, it's either the person to the right or to the left.
Okay.
Thank you so much. All right.
Tara, you ready?
Yeah.
Okay.
That much speed of the-
Okay. Well, good morning, everybody. Today is March 20th. We are doing a first hybrid meeting since COVID, so very excited to welcome everybody here. My name is Jimna Miller, and this is the Autism Spectrum Disorder Advisory Council. So I've got some of my council members here at the Legislative Office Building. We also have a number of our council members joining by Zoom, and I'm hoping we have some additional members of the public that will also be joining us today. So I'm going to move through the agenda first with a welcome, and then we're going to move to public comment. Tara, are we ready to accept public comment? Okay, and if we have members of the public, where should they go if they? Okay. Okay, if there's anybody here, where should they stand for public comment? Okay. All right, do we want to open it up for anyone that's present here in Hartford with us to open it up for public comment? And if not, we can move to any members that are joining us from, excuse me, any member of the public that's joining us from Zoom. We'll open that up for public comment now. And they would unmute themselves, Tara? Raise their hand? Okay. Okay, we don't see any hands raised. We're going to move to item 3 on the agenda to review and approve the January meeting minutes. Tara, you had circulated those to the members, and I would just ask for a motion first to approve them.
So moved.
So moved. Excellent. They've been approved. Item number 4, we're moving along. We have autism waiver updates from both DSS and Carillon, and I believe we have members here in Hartford with us that will begin to provide updates.
Good morning. I'm Amy Dumont. I'm the Interim Director of Community Options at DSS, where we oversee the 10 Medicaid waivers. I'm here with Mike Olison today from DSS. I'm going to have him review the current waiver numbers, and then I'll provide some additional information.
Excuse me.
Currently have 2,067 people on our wait list. Sorry, we currently have 2,067 individuals on our wait list, 330 cases assigned to case managers, 218 people who are actually on the waiver fully done through the process. And we're working towards getting everyone on the waiver.
Do we have any questions from anyone in the room or anyone that's on
So-
Zoom?
With those 330, does that exhaust how many you're allowed to have this year? Or where are we in terms of what you've been budgeted for this year?
So that would be the end of what we were budgeted for this year. We have another 120 slots coming July 1.
So do we think that we'll get many more that are due on this year?
That is the hope. And fortunately, it's a slow process and depending on the individuals and what their needs are.
Mike, when the 120 come on slotted for July, providing everything works out, is the process that you're already doing outreach and any sort of anticipation or any research finding people? I know there's a whole process for the outreach to prepare folks.
So on a regular basis, our resource specialist sends out mailings to the waitlist individuals to try to get updated information. I've also just sent out a mailing to the next 120 people to try to get updated, to give them a idea of what's going to happen next, what the steps are, things that they would need for disability determination, Medicaid, all of those things. So we'll see what the response is.
Okay, and do we have, what would the next step be? So if they get a response or if it's return mail, you have that, which you shared before previously, you work through the process of social media, public records,
So the ones that
anything.
come back returned, I can then start going through impact or all of our different things to try to get that ahead of time for July 1 to have the most current information.
Okay. Any questions from anyone on Zoom? Looks-
Yeah. Yes. I have my hand up. Jim, it's Lois. I wonder, Mike, what is the biggest problem in getting people on currently? Is it the lack of providers? Is it the lack of staff? What is the big issue?
Now,
Or-
getting people on the waiver isn't even affected by providers or not a staff. It's getting people through the Medicaid process. Some individuals have to do a spend down or they have to set up a special needs trust. Some individuals might be hospitalized right now and we need to wait. We had one individual that has been on the wait list for 10 years and all of a sudden received a large inheritance from his grandmother to purchase a condo. He needed some time to do that. It varies on family to family. Some people
Okay.
stop responding. We have to follow up and go back and forth. It's a challenge.
It sounds it. Some of what I've heard, and that's what I'm trying to clarify for me, is that once they get on the waiver, once all of that paperwork, all of that stuff is done, there's still a slowdown and actually getting services in place. And is that because of the lack of providers?
Some of it's lack of providers or it's the providers don't have enough staff for all the individuals we could send to them.
Yeah,
We're
that's
still onboarding new providers. We have an intern that's going through a list of providers from other waivers that aren't on our waiver and contacting them. It's an ongoing process.
So just good news, Lois, in terms of providers. I mean, we have had 4 new providers credentialed since January, and going through the enrollment process right now with DSS and Gainwell. So we have seen a little bit of a pickup in provider enrollment, which is definitely a good thing, but I am concerned as we forge forward and we start adding more people that we may have a little
exactly.
back up again, but
I'm very concerned about it. I think it's a huge problem. And I think we're heading towards, I think we're in a crisis. I think we're heading towards a bigger one. I think one of the biggest problems we have is going to be the lack of providers. And we have folks that have been reported to me, Amy, that are just not able to find, that have been on the waiver and have lost their provider and are unable to find another one.
Yes, I understand that's unfortunate. I do see that reality, unfortunately, in other waivers as well, that require a lot of specialization, like the acquired brain injury waiver. I just hope that while we have our intern, maybe she could affect some change with reaching out to others. Fingers crossed that her presence will definitely help us. So I'll definitely provide another update in terms of waivers at our next meeting in June, providers in June.
Mhm. I just feel that we need to address the issue and figure out how we can attract more people. I think that this is probably true across disabilities, but I think with autism, we're having more of a problem because we just don't have people trained in this disability. And some of that has been the lack of funding. And I just think that this is a bigger discussion. Um, and we really need to be looking at how we're going to solve this.
Yes, it is a bigger issue. I'm very fortunate that I have my contract with the Center for Children with Special Needs, who does provider training, which is great. And I could certainly send to the council, or Lisa can send to the council the trainings that they are doing for providers. Doesn't solve the entire problem.
No, it doesn't, but that's, a little bit of a help. But I think that, I don't know whether we look at, how the council looks at this, if this is one of the issues we need to be addressing this year. And if we can be of any help.
Any other comments from anyone online? Thank you, Lois. And I love that idea. And when we move to agenda item number 6, I think that will be a well-played subcommittee, perhaps. Anyone else from Zoom that has questions for the autism waiver update?
Is there anything that we can be doing to help with the wait list? In whether it's, notifications or anything else that we can be doing so that the process doesn't take so long?
I would defer to Mike as well, but I think we're doing what we can do right now with the mailings and the follow-up and, looking through impact. And I have talked to my Medicaid director about the possibility of getting some type of access to systems that DCF has, like LexisNexis, where we could, maybe delve deeper into where somebody is. But, I guess we're in discussion about that. So it won't make it so difficult for Mike and the case managers to locate somebody. But that is something we're talking about. But I think right now, with the resources we have and what we're doing, I'm open to suggestions from anybody. I think between Mike and Lisa and Nate, they're doing a great job in trying to reach people. It's difficult. When people are contacted and they moved out of state, or there's circumstances in their life that makes them not able to take that slot. It's kind of heartbreaking, but because they've been on that waiting list for so long. But I think we're doing what we can do right now. But definitely open to whatever ideas you have.
Right. Thank you. On Zoom, we have 2 hands. Jan? Sorry.
Can you tell us the 120 people that are coming off the wait list in July, what year did they originally enter the wait list? I'm just trying to figure out what year you're up to servicing.
Right now, we're onboarding people with a year 2014.
Thank you.
And Sarah?
Hello, everyone, and thank you for the work that you're doing. I know it's just a real challenge. I wanted to kind of wonder aloud, might we be able to enlist others who already work with these individuals to help get the documentation that you need? I mean, as a physician, I'm not seeing all of the older individuals, so I can't, as a pediatrician, excuse me, so I'm not seeing all of, the older adults, but I send a lot of patients to get on the waiver. So again, they may not be, 10 years later, they're not with me anymore, but majority of them have conservators, their parents generally are conservators. We have care coordination that could help. I mean, getting documentation, I understand is really hard. But could that be facilitated with others in the community? That it takes a village kind of thing. Is there any way that you can collaborate?
We do that a lot already. It isn't so much the documentation for disability. Most of the holdup is the getting on the Medicaid process and people getting the documentation, and people that start the process and then they stop responding for a month or two. Then you need to send out a notice of action, and then they have time to respond because they have hearing rights. And then they start the process again. We've had one family we've been working with since June to get them on Medicaid, and they haven't finished, but they keep doing enough to keep the process going.
Right.
Every case is different. We had one individual, her mother was going through chemo and just couldn't do it right then, and we needed to wait.
I guess I wonder, again, I don't know what's available for adults as far as care coordination, but that is resources. That's what we use our care coordination agencies for. So, I mean, to help get kids on Medicaid or get those kinds of things. So when the families really struggle, we have kind of support from another agency. And so I'm just curious if there's maybe some kind of correlate in the adult world that can assist you with that. Just a thought.
I mean, a lot of people may be against this, but my thought is, we should let people, like, even an annual or every several years reminder, hey, by the way, you need to be on Medicaid. I think we should give priority to people who are on Medicaid already, especially with our limited resources. I don't think, it's a good use of anyone's time to spend, 9 months, trying to help somebody get on Medicaid when there's people who can be receiving services who probably, if they're already on Medicaid, this is unpopular opinion, then they probably need them more. So they're prepared, right? I feel like maybe also, if that is the case, if we say, right, hey, we're giving a priority to people who are already on Medicaid, then I think that will motivate people to be ready, right? Like, why shouldn't we do that? And we're not saying that. I think the important thing is we're not saying you miss your chance, right? But I think we should definitely give a lot more priority to people who are ready to go.
I agree. I agree with that. I really do. I think that makes sense. I'm wondering if people, could just on a yearly basis while they're on that waiting list, be notified of some kind of letter go out and add to the waiting list in general, saying, this is just a reminder. When you come up for the waiver, you are going to need to be fully ready with Medicaid.
And if you're not, you're going to have to wait 6 months to a year. You do the work to get on Medicaid and then come back. We have so many people who need help, right? Just say, hey, look, if you're not ready, you're not going to miss your spot. You're not going to have to wait for 10 more years. Come back to us in 6 months. We're going to come back to you, like almost like an annual enrollment thing. And again, you're about to enroll 200 more people, right? Do those 200 more people, have they got a letter knowing that they need to be on Medicaid and what they need to do to be on Medicaid? there's no reason they shouldn't get something like that now. It's a waste of limited resources.
So Andrew, it's Amy. Thank you. I appreciate that. Nate is already doing that. He's already sending out mailings. And we're reaching people, that way, especially when we need to ask for updated testing if the child is younger. So we already have that process in place, which is great.
So all the people in July have got letters that they need to be on Medicaid and how to get on Medicaid.
They've gotten letters that they need to be on Medicaid, that if they have updated testing, they need to supply that. The problem with going with people that already have Medicaid is a lot of our individuals, if they weren't on a waiver, wouldn't qualify for Medicaid because the waiver waives certain requirements. A lot of individuals that
Sure.
already have Medicaid, it's not the right Medicaid. They have it just for
Sure.
limited things, and an asset check and those things are still needed to be done.
Okay.
That does make sense. And I agree. I guess I just wonder, is there a way to maybe take some of the work off of you guys and say, okay, hey, your slot, so we can, work, so we can put more of the work on them so we can help more people, right? Instead of just holding it up. Is there a way where we can say, hey, here's what you need to do. You need to do it if you want this waiver and you want up to $50,000 a year from the state of Connecticut. Here's what you need to do. Come back to us within a year or you lose your slot.
Amy, I wonder if we put it something like on the actual application form and start the expectations sooner, that this would be if we adopt this process. Obviously, there's a lot of things that goes into gaining that, but it would be that setting that expectation, and or when an application is received with an acknowledgement letter, we have your application, you're being placed on the waiver, there is a waiting list.
Nobody's going to remember that from 10 years and all the letters they get.
But I disagree. As a parent, if I knew I needed to establish a special needs trust, if there were steps, I mean, I would respectfully disagree. As a parent, I would make sure that when my number came up, I'd be ready. Just my 2 cents.
I believe with the eligibility letters go out, there is the expectation in there that they need to have Medicaid and the things that they need to do.
And remember that eligibility letter goes out from DDS. So I will double check that and report back to you and make sure that that's on there.
That's super appreciated. Thank you, Amy.
Yana, I saw that you had your hand raised. Did you have something you wanted to add to this conversation?
Yeah, I was looking at the income limits. I know that it's waived for the program, but still for Medicaid, there's income limits. The thing that gets me is sometimes maybe parents don't want to trap their child in a cycle of poverty because in order to be able to qualify for Medicaid, you have to make a certain amount of money. We're basically trapping people in a cycle of poverty in order to be able to get these services. And parents, I don't know, some parents wouldn't want to do that. The kid who has this inheritance, they don't want to trap their child in a cycle of poverty in order to get services.
Then we have 2,500 other people who are waiting.
Yep, exactly.
Understandably, I need to go by application date. We can't arbitrarily say that someone has needs greater than someone else. So that's why we go by application date and we hold the waiting list that way. If there are changes that we can make in the future, I would certainly have to go to my CMS colleagues and ask if that's something that we could do. I don't know. We don't operate the waivers that way, but I could certainly look into that.
I think we definitely do need to do something to that effect, to have some emergency flexibility. Because let's face it, a 12-year-old child who's living with mom and dad has very different needs than someone who's pushing 40, who's living with mom and dad. Parents are not in the best health. They need to get out. They need the support. They're in very different spaces. And that person who's nearing crisis should be given priority over I love children, but I'm not trying to be mean or anything, but over a 12-year-old who has security at home. They have they're going to be living with mom and dad for a while. They have time before they turn 18. Whereas this 40-something-year-old whose parents are not in the best of health, something happens to mom and dad tomorrow, boom, they're out on the street because they have no place to live. That person needs that we need to have some kind of a safety net for that individual. I get it, we're a lifespan waiver, but it's for a little child has a different needs than a grown up.
So because we are a lifespan waiver, we do have a few folks that are over the age of 65. And they are given the choice and the opportunity to transition to the elder waiver where there is no waiting list at that time. But we have had some individuals that have declined that. And that's their choice.
Why should it be their choice? Why should they be taking spots from other people?
Exactly, Andrew. I second what Andrew says.
It's always a client's choice about what services they receive and where and how. So,
And
Well,
sir,
I mean, but it doesn't have to be if we change it. I mean, if we can serve more people because they're eligible for another program, I feel like we should force that. I don't think it should be their choice.
Andrew, I think, and sorry, not to single you out, Andrew, but I think we move this to item number 6 when we start to determine any subcommittee priorities.
Okay.
Just because we started late with technical difficulty, but I love this conversation. But I think it works nicely into item number 6. Carol, I did see your hand up. I quickly do want to move on. We have to have a Carolyn update as well.
Yeah, this is a little bit off topic though. So I don't know if this question is for Mike or Amy, but you said that when you send out the letters for the 120 that are being onboarded in July, and you ask for sort of updated testing and things like that. And I know that's to determine if they still, have the IQ above 70 and all that stuff. And is there any movement to be done for that 2067 to say to them, maybe you want to have, updated testing to you because you may not have to wait for 5 years for the waiver if you are qualified now for DDS services. If that makes sense.
Mailings are sent out regularly to the wait list. We've had a number of individuals that have sent in updated testing and they have gone back to DDS for services.
We
Okay.
work.
I just wanted to know that was happening.
We work closely with DDS and Dr. Murphy and her team there when we have individuals that need to go back. So, but thank you, Carol.
All right. Thanks.
Okay, I'm going to move on to the next agenda item. Sorry, Caroline. We need a Caroline update as well. That was also part of agenda item 4. There we go.
So for those who don't know me, I'm Jen Crum. I'm the Director of Autism Services at Carolyn Behavioral Health. We are the administrative service organization that oversees the authorizations for behavioral health services for Medicaid individuals in Connecticut, and I specifically oversee the autism services. So we'll go over our February data. Go to the next slide. So as of March 5th, we've changed this slide a little bit in order to be able to distinguish the numbers for the service delivery and direct observation and direction, as those lines used to completely overlap. So now you can see that it's the black line and the bright green line is the direct observation and direction, as well as the service delivery. The reason those lines so closely overlap is because those authorizations happen at the same time. So every time we authorize direct service delivery, we also authorize the direct observation and direction of the behavior technician while they're providing services to the individual. Our highest utilization remains the treatment plan and program book development. It's been a hot topic in every conversation around the state lately. It is something that we are starting to look at. It is available to individuals every 6 months or more as needed. So if an individual is discharging from a higher level of care, or they're switching to a new provider, or behaviors change, that assessment is available to providers. So it is expected to be more highly used than other services. But we are taking a look at the utilization of that and how we can better manage that. Our group treatment services, the 297 cumulative authorizations since 2021, remains our lowest authorized service. It's always been difficult to have children. The group treatment services are up to 8 individuals, regardless of payer source, with 1 clinician delivering the service. So it's difficult to manage. Yeah.
Is telehealth leveraged for group?
It is.
Okay.
It is. Yep. And actually post-COVID and kind of reintegrating kids back into the community, we actually have seen a little bit more utilization in the group and services, but it's important to remember that they can't also have a one-to-one in that group treatment. So they really need to be ready to be in that group treatment. You can go to the next slide. So the next slide we look at current authorization. So what is currently being delivered to individuals? So right now we have 423 individuals accessing a diagnostic evaluation. We have 4,487 individuals who are connected to a provider and receiving direct treatment, and then 79 who are currently receiving group treatment services. So that still remains quite low. You can go to the next slide. So here we look at admissions, and for this purpose, admissions is defined as the first authorization for ASD services. So the age that they start their very first authorization. So consistently, we see our 3-year-olds as the highest utilizers, which is really good. We like to see that they're transitioning over to the Medicaid services post birth to 3. We do have some individuals where their birth to 3 services don't meet their behavioral needs. They're still able to access their occupational therapy, their speech, all of their other services through birth to 3. But some individuals choose to come to the Medicaid services for their ABA services specifically. So under the age of 3, they can access their other birth to 3 services and then specific to the ABA with us. But that does continue to be our largest group of individuals. So that's exciting to see. And then we look at our demographics. So our unknown bucket remains our highest number of individuals or highest percentage of individuals. So unknown is defined as the individuals who do not identify their race or ethnicity at the time of their Medicaid application. So that's a bucket that we just keep open for them. So that's at 32.4% of our individuals are unknown. We have 27.2 Hispanic individuals, 21.9 white, 13% Black, and then 2.25% Asian. To the right, we look at the DCF involvement for youth who are receiving Medicaid services. So the large number, 95%, are not involved with DCF or voluntary services at all. We have 5.5% who are involved in either a CPS or committed to DCF. And then the teeny tiny 0.04% who are receiving services through the Carelon voluntary services as well as their Medicaid funded services. And while that is a very small percentage of it's 3 individuals, they are our most complex individuals in the state. They have heavy involvement with different agencies and require more than just the ABA support in order to maintain stability in the community. Our region 4, which is the Hartford Manchester DCF region, so we just break it down by the DCF regions, is our highest utilizer for individuals. We also have the highest number of providers in that area of the state, so it's a little bit easier to connect individuals, while it is also some of the most diverse area of the state. So we do have trouble connecting individuals if you speak a language other than English. It is challenging to connect to a provider. And then region 3, which is that border along Rhode Island, is our lowest number of utilizers. We have the lowest number of individuals, but also only 2 providers in that area of the state. We do have 1 provider in Rhode Island who comes over to the southeast border of Connecticut, and that is helpful for those individuals, but it is really challenging to connect kids to services in that part of the state. Go to the next slide. So here we look at our provider enrollment, which continues to grow. Is really exciting. However, it will never be enough, as Amy and Mike know, it'll never be enough. So this is the number of clinicians, so the BCBAs and licensed clinicians able to oversee the services. We don't keep count of the behavior technicians, which we know that that is the hardest to staff right now across the state, regardless of service that you're looking for. So we have 141 agencies. In that agencies, we have the 1,051 providers who make up those agencies, and that's all of our providers, including providers who are able to do the diagnostic evaluation. And then we have 986 individuals who are able to oversee the direct service delivery for individuals. So they make up those agencies as well. Most of our agencies are made up of BCBAs, which is to be expected. And then we have some combinations of different groupings, LPCs or LMFTs or LCSWs as well. And then last, we look at the work that our care coordinators and our peer specialists are doing. You can go to the last slide. And this is the direct work that our care coordinators and peer specialists are working directly with families, reaching out to gather documentation that's needed in order to start services. And they also follow them 45 days post connecting to a provider to make sure that all of their needs are being met. It's a good match with the provider. So right now we have 109 individuals who are working to identify a provider. So we have referrals out to multiple providers to find out what their wait lists are. Then we have 62 individuals who are actively on a wait list for providers. So it's important to remember that we don't manage the providers' wait lists at Carelon. They do report to us on about a weekly basis where they're at with their wait lists and how many people they have on our wait list. Some of our providers don't maintain a wait list at all, and they just want to work directly with people as they come in and let them know how long it might be until they have a place open. We then have 71 individuals who our care coordinators are working to gather documentation. So that could be the diagnostic evaluation, the supporting letter if that evaluation is more than a year old, or releases of information in order to give us permission to reach out to providers. We then have a whole other cluster of individuals who are working towards discharge from a higher level of care, or are waiting to discharge from their birth to 3 services or transition from their birth to 3 services, or are in transition, like Amy was saying, some might transition from the DDS waiver to full Medicaid services, depending on what their needs are. The 11 who here is labeled as receiving services, because this is a stagnant report, that provider might be requesting an authorization the morning that this report was pulled, and there's a gap in the authorization process. So they might have an authorization by the end of the day that this report was pulled, but there's 11 individuals who are waiting for an authorization as of this day on February 12th. So that's our Medicaid data. I don't know if there's any questions. Sure.
So of the providers who are reporting on their wait list, how long is it what's the average wait time for families?
Yeah, so for the diagnostic evaluation, if families choose to go with a smaller provider, it's about 2 to 3 weeks. If families are choosing to go with CCMC or Yale or larger organizations, that could be up to a year. For direct service delivery, it's anywhere between 6 and 9 months right now, definitely closer to the 9 months in that region 3 area of the state. And if you speak another language besides English. Over this past year, we did work to gather information from our providers if they speak other languages, if the clinician speaks other languages, if the behavior technicians speak other languages, and then if they also provide services either center-based or primarily in the home. So that is actually on our website now. It's a massive Excel document that we're working to convert into an interactive map that will have that information. We're hoping that it'll be easier for families to navigate if they need a certain language in the home.
I have a question.
Go ahead.
Hi, good morning, Melissa Gagne. I had a question. In my work, I'm a special education attorney. I know that most of the services happen in the home or at a center-based. Are there circumstances where the providers are working at all with a child that might be on their caseload, that where they're working with the child's PPT team at the school to help sort of support the team in any sort of behaviors that they're interventions that they're working on in the home to sort of promote that wraparound wraparound support?
That's a great question, Melissa. So because they're Medicaid funded services, these services cannot happen in the school setting specifically. However, they do attend PPT meetings to gather information and share information. So if there's things that are successful at home, they could share that with the school. And through the functional behavioral analysis process to start services, they are required to do observations in the school setting. So that collaboration is expected. It's just that the services can't happen in the school setting.
Right, I understand that. I'm happy to hear that they're attending PPT meetings, and I haven't seen, in my experiences, I haven't come across that, but we'll certainly be looking for it. Thank you.
Sure. So it's important to remember they don't get paid to attend PPT meetings. So certainly with having Zoom and those options, it's more likely that they're attending them because it's easier, it takes less time out of their day in order to do that. But a lot of our providers do take the time to attend PPTs.
Most PPT meetings are still happening virtually. Most of them are.
Our providers like that.
Jennifer, would you say that parents, or maybe, I don't know, Melissa, maybe this is questions for you. Do you think parents with children school age know that they would have that sort of access or, additional person join a PPT?
Yeah, so our care coordinators and peer specialists prior to starting services educate families on that, it's up to them who they invite to a meeting. And if they want to have their BCBA or their BT, who's working with them on a regular basis, or even our staff sometimes will attend just as kind of moral support to be able to help them through that process and prepare them for that process. So let them know what kinds of questions to ask and what kinds of information to expect to hear. But it is, we do educate the family that it is up to them as to who they invite to those meetings.
That's once you're involved. So I find the bigger education that has to happen for parents is how to access these services to begin with. And so that's the work, is getting them connected with these services, and then
Yeah, so we actually have an initiative this year. Our team lead for our care coordinators is actually going out to different referral sources, primary care doctors, BRCA 3 programs, to be able to educate the care coordinators in those programs on transitioning over to the Medicaid services.
Could I ask a question? Do you have any training specifically for parents? So that they know exactly, ASRC used to do that. We did it for years. We did a series that was a training, and we now, as most people know, we've merged, and it's not happening. We're hoping that will happen down the road again. But do you do that?
Training for the understanding of educational things, or for what training specifically?
Service in general, what they can expect and what they can expect, just so they know what their rights are, for the whole process, PPT process.
So no, we don't do it specifically for the PPT process because we are not experts in the PPT process. We're Medicaid care coordinators. So I think we would connect them with an educational advocate to help along with that process. But we can't say that we're PPT experts on my team.
I would suggest that you do that. I think that's really important, or have an expert in to do it, in-house to do it. I think it's really important.
Yeah, I could bring that back to our state partners. Again, I'm not sure if that's blurring lines because we're Medicaid, and really helping them access the advocates and people who can help them, directly access those services. But I can certainly bring that back to our state partners and DSS to ask.
Yeah, it's an overwhelming process for families.
Yep.
I mean, it just is. And okay.
it is. There are a lot of agencies around the state that provide that. And I do a lot of these for parents also. So it's connecting them with those agencies that are maybe already doing them too.
Yeah.
Training.
Yeah.
I think that's important.
Yeah.
Specific to this diagnosis.
Agreed.
Question, do you track the number of psychologists and psychiatrists who are willing to accept Medicaid and individuals?
Yeah, sure. So Lynn from Hospital for Special Care was asking if we track the number of psychologists and psychiatrists who are able to see these individuals for medication management specifically. Is that what you're asking? And evaluations. So for the evaluations, we do those authorizations, so we are able to track that. That's the information that we report on who's accessing the diagnostic evaluations. In terms of medication management, it's a totally separate authorization process. It's a generic behavioral health authorization that doesn't go through the autism team specifically. So we would have to track it based on the diagnosis that they're indicating on their claim when they're billing for the service. It's a challenge for us connecting our kiddos to medication management, especially, because they're on Medicaid. Usually it's clinics that are available to them rather than independent practitioners. And clinics typically require some form of talk therapy or therapy. And that's a huge barrier for our individuals who are nonverbal. So we do a lot of education for the clinics to be able to do more family therapy and working with the family as a whole rather than that individual. In order to be able to access the medication management through them. It's a huge barrier for our kids.
It would just be helpful as we have such significant waiting lists. I think as one of the only providers, if we knew that where other folks were, that we could potentially connect resources to.
Yeah,
be helpful.
For
Thank
sure.
you.
And then there's a question in the chat. Did you say that diagnostic evaluation must occur within 1 year, or does the documentation just need to be provided within the year?
So if we have a diagnostic evaluation that was completed more than a year prior to us receiving it, we need a supporting letter. And that supporting letter could just be a pediatrician saying, yes, I agree with the diagnosis of autism. It doesn't need to be anything extensive. We get those supporting letters pretty easily, but we just want to make sure that the diagnosis is still relevant and impacting the child.
Yana, go ahead.
So I just want to know, do you keep records on restraint and seclusion? And and yeah, because you provide the funding for the services, but do we have records on how much have this year? I know in the past year it's been quite a lot because I was just reading an article that was a huge number of restraint and seclusion still being done. So I just want to know, what are we doing to protect the rights of the children? Because some of these things, some of this restraint and seclusion, I think it's abuse. It's just being disguised as behavior modification. And
I would agree,
I don't think
Janice. So
I don't think we should be paying for it.
So our providers are actually not permitted to restrain or seclude children in their home settings. And actually most of the programs that train individuals on restraint do not permit it to happen unless there's a medical professional able to oversee that. So that's part of the reason why that's not permitted in a home setting. So our providers are not permitted to write that into plans or engage in restraint or seclusion. They need to write plans in order to call for emergency services if behaviors that were that unsafe.
And what about in the clinical day schools?
I can't speak to that. We don't authorize those services. I can't speak to that.
But no, not in the home. That's all I wanted to know because it's restraint and seclusion is nothing but child abuse, and we shouldn't be funding it.
Yep. So we don't authorize the school clinic-based services through Medicaid.
All right. I just wanted to know because it's something that's near and dear to me. And
Absolutely.
I think we should be overseeing, we should be taking a look at what's going on in these therapeutic schools because a lot of the time it is
Just
still
to be clear, Yana, just to be clear, right now under Connecticut law, seclusion is not permitted. And restraint is not allowed to be a planned intervention in an IEP. So I know it happens. I'm just saying seclusion should not be happening. The Connecticut law precludes that.
Thank you, Melissa.
Go ahead, Brian.
I think that's great in theory, but I think a lot of schools are still getting away with stuff that they shouldn't be getting away with.
Brian, go ahead.
I just wanted to correct the last statement. Seclusion is permitted as an emergency, in an emergency situation in schools, as is restraint.
Emergency, correct, but not as a standard
Yeah,
measure
just
of intervention.
the way it was stated, it was seclusions weren't permitted at all. So I just wanted to clarify that.
Got it.
And prone restraint, I think, should never be included in anyone's plan, any school, because kids have died from prone restraint. There's so many cases where this prone restraint has ended in tragedy. So I think prone restraint should be illegal and stop. And seclusion, we need to be protecting our most vulnerable individuals, and those are individuals who can't speak for themselves, who are nonverbal. It's disgusting to see how much abuse happens in these special education classrooms or by staff because they know that this is a vulnerable individual who's nonverbal, who can't speak for themselves. That's why this stuff needs to be outlawed, because it's only thing it's good at is it's not good at modifying anyone's behavior. It's good at causing people to have PTSD and trust issues.
Absolutely,
Yana.
absolutely agree. We are at the top of the hour and we do have a number of items still on the agenda. Thank you very much, Jennifer. Thank you, Mike and Amy. Next on the agenda, we have OPM updates. So Tara, I believe that's you.
Thank you. Just a brief update on membership and bylaws. We are working to get reappointment letters now that everything's been changed over to OPM. So some of you might hear from Tom for your resumes and information. So if you do get that email, please respond to him as promptly as possible so we can get all those reappointment letters taken care of. And once we have all of that, then we can vote on the new bylaws and chairs as we discussed in our first meeting.
Okay, so the vote can't happen today because I know, or
I'm going to hold it until next time. So I know that we have everybody. My I's are dotted and T's are crossed.
perfect. All right.
Thank you.
Okay, any other comments or questions from Zoom? I'm going to move forward to agenda item 6, council business, determining 2024 subcommittee priorities. Tara, did you want to kick this off or did you want me to start?
I think before we start, I'd like to get an update on the housing committee because they did meet in between meetings. So if we can start with that, that would be good.
That's where I was going to go to. Okay. Subcommittee.
Stephen or
housing.
Yeah. Lois, do one of you want to provide an update?
Stephen?
I can defer to Lois at this point if you want to, Lois.
No, I just got back from 3 weeks away and so it would be good if you could do it. Do you mind?
Nope, don't mind at all.
Thank you.
The housing subcommittee met on one occasion between the last several meetings. We had the opportunity to have a guest speaker come in from Massachusetts and their program, which provides housing assistance to people with autism and the like. And it was a tremendously well-attended session, and the information was great. So we worked with and had about a little over an hour session with them to find out about how their program was working. And it's been in place for quite a while at this point, and it is really quite well developed. And so we're looking at that. We've also gotten some referrals to a program in Indiana, and Jimna, thank you for that, regarding their program for housing of persons with autism. And part of the issue there is that in some situations that we're looking at, they are, mostly segregating people into housing situations where it's all people with autism, which is something that, when we were talking about segregation, we're like, are we going to follow that kind of a model or not? So that's the meetings that we have had since the last one. Lois, can you add anything to that?
No, except to say that the program in Massachusetts is phenomenal. And I really feel like it's something that could be created here, recreated here. It's something we're sort of looking at. It's needed. Housing is a huge issue. I really feel that it needs to be on our agenda this year, the advisory committee. It was really worthwhile. And my thanks to Carol Behrens, who was working with Stephen and I in really searching for what's out there, because she brought this to our attention.
Lois and Stephen, I had a question. What is the goal or the objective of the committee today as it stands? Like, what would your first priority be? Is it just to inform? I just think it's worth, are you just doing like discovery to see what's out there? Because that's what I'm hearing. And then is the goal to then do an evaluation, move to legislation, find budget out? What is the end goal here?
Well, I
Or is it
think
to the committee, and then we as a committee, you inform us, and then we're able to take action.
Yeah, I mean, I think that that's the way we're supposed to work as a committee. Would I be right on that?
Yes, that's what I would like to see. Yeah. Okay. We just want to make sure we're in lockstep.
Yeah, absolutely. But it's really hard when we see a project that might be a community-based project, maybe not to follow up on that, because our needs are so many in this area. For instance, they provide, they are a small nonprofit that provides a number of different services to families. When families are looking to for housing resources, they really haven't any place to call here in Connecticut. I mean, they really don't. And they need that. It's very, very hard to know, where do I begin? Unless you have unlimited resources, and most of our families don't. So it would be nice to have a nonprofit that might offer this as a service.
And we were lucky enough in the meeting to have at least one nonprofit attend, just in addition to our committee members, who had a real interest in this topic and in getting involved in the whole housing issue. And, we've looked at programs in Massachusetts, looked at programs in New York and New Jersey and Pennsylvania and other places. And, a lot of decisions would need to be made on how that focus would occur. Would it be specific housing just for people with autism? Would it be incorporating this into new housing that's coming up and making sure that there is designated housing for people with autism? Or where on that spectrum are we going to go, or are we going to focus? Because there are a lot of different programs out there. And I think getting that information together and then presenting it to the whole committee and saying, this is what we've discovered and this is what, we may be recommending, is something where we would be wanting to go this year.
And we're probably looking for more than one solution.
Yes.
Given, the spectrum of autism, and also the spectrum of resources that families have. I don't think we're just looking for one solution. So it's a huge job.
Lynn, did you have something?
I'm sorry if I missed the name of the program in Massachusetts, if you could share that.
What was the name of the organization in Massachusetts that attended your subcommittee meeting?
I'm not hearing.
Yeah, Lois, what was the name of
the recording for that subcommittee is on our website. So if anyone wants to go back and watch it, there was a slight interruption. So there's a part 1 and a part 2, but both those links are on the website along with the agenda and meeting minutes.
Yeah, I'm not looking at my file right now, so I'm jumping options and I'm not looking at my notes right now, so I can't tell you what that is. I'm sorry.
I attended the meeting with Lois and Stephen, and it was Kathy Boyle from Autism Housing Pathways in Massachusetts. It's a nonprofit 5013C.
Thank you.
I'm difficulty right now.
Okay, Lois, thank you. Tara, did you have something?
Yeah, I just wanted to update on the 15 wrap waivers for autism housing. We are still in the process of working on that. We're hoping to, once the contract is set and the provider is going to work on identifying who gets those, which is obviously going to be the hardest part as we're piloting this model. And we will be bringing them in for further discussion. So we're hoping to give the council an update on that process as we're moving forward with it.
Excellent. Should we continue on council business? I think we still need to identify it or discuss if we want to add any additional subcommittees. I don't know the best way to solicit
Yeah, I think
this.
it's open for conversation. I think that there was an overwhelming opinion by everyone on the council to continue subcommittees and do some work outside of our larger group meetings. Housing, we can, obviously, there's a passion there. We can continue, especially with these upcoming wrap certificates. We definitely would want to continue to have those conversations. So are there anybody who has any other suggestions for subcommittees that they feel? And I would like to see that there's a chair identified for each subcommittee, because there will need to be communication back to, me, so that we can make sure that agendas are posted and meetings are recorded. I have a Zoom link identified for all council business. So that is available to anyone. So I can easily set that up, but I just like at least one point of contact so that I make sure I get everything that I need to stay FOIA compliant.
I just have a question. The 15 wrap certificates, is there a particular population that's going to focus on within the autism? But
Autism
within,
supported
like,
housing.
are you focusing on like waiver participants, state plan, like?
We haven't identified that. That's going to be the hard part to identify who gets those first 15 slots. So
So just a question and a possible suggestion for a subcommittee. It sounds like education and training of professionals is a significant gap and a barrier to even accessing the limited services and things that, some folks have. So I know we've talked about that in the past, so I would just put that back out there for consideration.
I agree. I think that would be a great, would anyone like to lead that? Training and education?
I would be willing to
Okay,
do that.
thanks, Lynn. All right. And then we can coordinate and maybe send an email out to members and see who would like to participate in that subcommittee. Anyone else have suggestions? So we have housing and education and training. Is that where we're going to land?
I think we would do best if we concentrate on just a couple of areas. And so that seems like, to me anyway, those two issues seem to be the most important right now.
Okay.
Based on our earlier conversation covering the agenda item 4 for DSS, it sounded like, I know Andrew had a lot of we had a lively discussion about changing the requirement for prioritization. Would that be worth considering as a subcommittee? I don't know that that's appropriate, but I'm just putting it out there since it was an earlier conversation. I don't know how we move forward through that. Is Andrew, are you still on the line? Not to call him out, but or Lois, I know you're already on a subcommittee. Anyone else that wanted to keep that or raise that, or we just focus on these two? Okay.
We can just do that then. And I'll do the administrative work to set both of those up.
Okay. All right. I think we blew through agenda item 7, housing subcommittee. We're moving to CSDE updates, agenda item 8, autism guidance. Brian, is that for Brian? Okay,
Yes.
fantastic. Brian, are you available?
Yeah, sorry, I had to switch to phone. Can you hear me okay?
Yeah, you're good.
All right. Good morning, everybody. Thanks for listening in on this important topic. So let me just grab my camera here so I can see folks. All right. So I wanted to share some information that we have been engaged in some conversations around our autism guidelines and for eligibility as well as programming. There's a current document that we have in place that is quite outdated. It was last revised in 2011. And so we know that a lot of time has passed and a lot of research and development in best practice strategies since that point in time. So we're getting ready to engage in a process where we're going to be updating and adjusting a little bit the document. There were some questions and concerns about the autism eligibility worksheet as well. As a State Department, we do have, there are 13 disability categories federally. In Connecticut, we also have OHI/ADHD and specific learning disability/dyslexia as well. And we do have guidelines around specific disability category worksheets, if you will, understanding that for a student to be eligible for special education, the student must have a disability. That disability must adversely affect their educational progress and access and require specially designed instruction. So those 3 components are at the heart and the foundation of what planning and placement teams are doing on during initial referrals at eligibility PPT meetings. And of course, designing comprehensive evaluations to be able to make those determinations. So we have heard requests from the field, from parents, from advocates and attorneys to update the worksheets that assist the planning and placement teams. And so what I would like to do and pose to the council opportunities for either perhaps a subcommittee or a subgroup to respond to or the draft updated guidelines once those are in place around eligibility determination. We're going to be focusing on the worksheet as sort of a central focus of the document and then explain the within the document to assist teams in being able to come to ensuring that there are appropriate identification and that it's not either limiting or expansive in that identification for eligibility within schools. So just wanted to mention that, pose that to the council, let you know that I'll be bringing you updates. But when the time comes that we do have a draft to respond to, I would love, based on the expertise of this council specifically, if there were either individuals or a subcommittee that could provide specific feedback, it would be very much appreciated. And I'm happy to answer any questions.
Brian, you know you'll get some feedback from me.
Thank you, Melissa. Absolutely.
As a parent of a school-age child, I'd be happy to join the subcommittee as well.
Thank you so much.
And Brian, just because I think it's important that the committee understands those worksheets, those are not, those are used, I think you put it perfectly, that they're used to assist the teams.
That's right.
They're not used to to come to a diagnosis or to come to an eligibility determination. They're used to assist the team in coming to that eligibility determination.
Yeah, most of our worksheets, like I like to use our specific learning disability worksheet as an example. We make sure to include all the statutory requirements, both state and federally, so that teams are aware and can consider those aspects. But we do know that the autism worksheet specifically, needs updating. Again, it's been since 2011 since it was last revised. So an evaluation is required, the determination by the team in those three components, and the worksheets are meant to help get teams to that determination and to that decision. Right now, we only have one of the disability categories worksheets in the Connecticut Special Education Data System. That is the multi-evaluation report for specific learning disability and SLD. But we have, and dyslexia. But we have had requests from school districts to include and add other worksheets to the system to assist. And that's something we're looking into as well, so that information is housed in one location.
Brian, where would we be able to find the existing 2011 version?
I'll send it to the entire committee. I'll send you a direct link so that you can see it and familiarize yourself with it. And you'll see the title of the document says eligibility and programming. And so our goal moving forward is to focus on the eligibility. We know programming is important, but we want to be able to approach those two areas a little bit differently. As you know, the autism spectrum is vast, and we've heard several times that each student with autism is very unique and individualized, and so we want to make sure that there isn't a one size fits all type of programming that moving forward, but the eligibility document is what we'll be focusing on. So I'll send that direct link to the full council so you can see the current state of the document as well as the worksheet.
And Jimna, if we do develop a subcommittee, I'm happy to lead it.
I'd like to, and thank you. What's the turnaround on that, Brian?
That's a great question. So, we're hoping to kick off the process this spring. And so I think it's unrealistic that we would have the revision complete for the start of next school year. But I do think it's realistic that we would have, be able to publish the document by January of next year. We'll try to improve on that target, but just, being realistic and ensuring that we have voice from all stakeholders through the process and, provide opportunities for public comment and so forth. I think, we'll be working towards sooner rather than later within the next school year, but I don't believe we'll be able to have it in place for the start of next school year.
Okay. Tara, can you add that as well? All right, fantastic. All right, any other questions for Brian before we moved on to general questions and announcements? Anything on the Zoom? Okay. Item 9. Thanks, Brian. Item 9, general questions, announcements. I did want to inform the council that there is an Autism Awareness Day being held at the Capitol. It'll be April 29th in the North Lobby at the Capitol building. There will be information tables made available from 9 a.m. to 2 p.m. So anyone would be able to, request a table if you wanted to be present there. Otherwise, it's open to the public. And then the program actually kicks off 10 to 12 at that morning. there will be legislators, special guest speakers, and the main contact for this event is Denise Drummond. And that's Denise.Drummond, DRUMMOND at cga.ct.gov. So if anyone has any questions, or if any organizations want to request a table or presence there. And I don't know, I'll ask the council, have we as a body, have we attended this or had representation there in the past? Does anyone know? I'm seeing nodding heads. Okay. As a council we have, not as your individual organization. Or is it muddied? Okay. Okay. And would we as a council, I guess I'll ask you, Tara, under the OPM direction, maybe, I don't know, do we want to have representation there as ASDAC?
I plan to attend.
Okay.
You know, happy to, I don't know that there's anything formal for us on the agenda or the day, but we
Okay.
definitely can be represented there.
Okay. All right. Any other, that was just the one update I wanted to make sure everyone had and that it was made available on the recording. Do we have any other announcements or
I didn't
updates?
know if any of the other agencies had anything relevant to update the council on. So that would be OEC or public health, or who else is on DCF? Anybody have anything relevant for updates for the council? Seeing none. Oh, go ahead, Anne.
Hi, this is Anne from DPH. Nice to see everyone this morning. I just want to mention that we will be working this year on our needs assessment for the Maternal and Child Health Block Grant. This is an activity that we do every 5 years. We'll be looking at existing data, gathering new data, including consumer and family input, and putting that together so that we as a group can decide what will be the action plan for the next 5 years. So if you receive outreach from anyone from DPH, myself or my staff, or other epidemiological staff who we have working on that, we hope you take the time and provide us input and feedback. We'll be doing different community groups, and it's probably going to take the better part of this year that will be working on it and submitting that. So thank you, everyone.
Thanks, Anne.
Mhm.
One more item I wanted to just inform the council. I had started to watch a recording that was broadcast on CTN of the intellectual delay, the IDD caucus that was held February 29th. It is in the public domain. It's on CTN and I think probably YouTube. But in it, we heard testimony from people around the state who are impacted by intellectual delay, whether it's small children, adults, self-advocates. I would encourage the council to find time to play it back. You can hear the legislators listening. You can hear their comments. And I think as we move forward as a council, under direction from OPM, I think that it's important that we keep in mind and we hear from the public frequently and often. So I think you're able to play it back at 1.25 speed if you don't have the 2.5 hours. Yeah, I think it's important. As you know, I have a school-age son on the spectrum with IDD. So he is not currently served on the waiver. But I do believe a rising tide raises all ships. And so that's why I'm proud to serve on the council. I think it would, knowing everyone's heart here that serves and volunteers, I just wanted to make sure everyone knew that the IDD caucus was held February 29th.
And I just have one thing for those who might be interested. I don't know if you're familiar with the Profound Autism Alliance. It's a new organization led by Judith Ursivi. I don't know if you're familiar with her, but they're holding their very first conference on April 5th in Massachusetts. And there's some phenomenal speakers. And the mission, if you don't know, is of Profound Autism Alliance is really to improve health, the connection, improve the research for funding for research around profound autism, those with intellectual disabilities as well. So I'm happy to send the link out if anybody's interested. I'm going to that conference. I'm happy to report back, but happy to send the link in case anyone else is interested.
Lynn?
Yeah. So, Melissa, we actually, it's Lynn, and we actually met with the founder went just a couple of weeks ago and connected, and the hospital will be attending that conference as well. And she, speaking of Autism Day, she has been here many times in her role with Autism Speak. So I think many of us know her from then. But yes, great work that they're doing.
Oh, I had something I wanted to bring up. It, for those of you who have been here from the beginning, and those of you who's just, we lost just this month another person that was a young woman who was a mentor. She was a support staff in the very beginning of the program. She was my first life skills coach, community mentor, and her name was Jen Cello. She was really great. Those of you who worked with her through Key Human Services, or maybe some of the case managers remember Jen. She passed away just this past month. So I just thought I would take a moment to remember her because she did make a big difference in a lot of our individuals' lives.
I'm so very sorry for your loss, Yana, and thank you for sharing that with us. I can't imagine the impact she had on your life, but seeing how far you've come, I'm sure it was pretty profound.
Thank you, Yana, for mentioning it. I had no idea. You know, she worked with ASRC on a number of projects. She was an incredible mentor, one of the best. And I am so saddened to hear that. Very, very sad.
Yeah, she was really great. I started working with her. She was the first person I worked with in 2009 when I started in the waiver, and I've come a long way because of her and staff like her. I need more people like her that can see the ability in a person and who are able to push people to see their true ability and work to the top of their ability. And she was amazing, and I just felt really sad that we didn't do enough to retain her. Because she ended up leaving the agency that I worked with her through because she wanted to do more.
Thank you for sharing that with us, Yana. And again, I'm sorry for your loss. I believe the next agenda item is just to review next steps, go over our next meeting. I think we'll add, hopefully everyone will turn in their appointment letters and their information to Tom Scanlon. And so we can be prepared to address some of those items we didn't get to today. Tara, do you want to wrap us up?
Sure. Just the next meeting will be June 26th, and it is a virtual meeting. So that Zoom link will be sent out. Everything is also posted on the website. So if you are somebody who's looking to participate, we welcome all participation. That link is on the website and on the state public calendar. So that information is easily accessible for anyone who would like to join. And if you have any agenda items or things that you would like the council to discuss, and anything comes up, please just make sure that you connect with me directly and I can get that out.
Thank you. And I hope to see many of you at Autism Day at the Capitol.
Are you gonna send out an email with the details? Because I have a terrible short-term memory. So I know I remember in the back of my head what you said, but if you could send something in writing about Autism Day.
It'll be in the minutes. I have the flyer.
Yep. We'll send it out.
All right. All right. I just wanted to make sure.
Yep. No problem. Have a great day, everyone. Thank you for joining.
Thank you.
Bye, everyone.